Alright team, lean in for a second, because today, Dr. Esma and I are uncovering why so many smart patients are suddenly choosing these game-changing dental implants. You're about to hear the kind of insider detail people wish they knew way before stepping into a clinic. And trust me, the reasons might surprise you. Dr. Esma, can we tease just a little of what's coming?
Absolutely, Rasim. What patients think they know, and what actually makes an implant truly life-changing, are often worlds apart. Today we're bridging that gap with clarity, real talk, and some myth-busting revelations. And by the end, viewers will understand why the smartest choices aren't always the obvious ones. Ready for the confusion to melt away?
Dr. Esma, you know what I keep hearing from viewers? They're tired of fixes that look good for a few months, but fall apart the moment life gets busy. One person told me they avoid smiling in photos because their old solution feels unstable. Another said they skip certain foods out of fear something might shift. It's relatable, but also exhausting. Are people overestimating how complicated a lasting fix really is?
They are, Rasim. Many patients assume a stable, natural result requires endless maintenance or painful procedures. In reality, the messy middle is usually caused by outdated solutions or mismatched treatments. When people realize implants can simplify daily life instead of complicating it, everything shifts. And that's why this choice feels smart rather than risky.
So, Dr. Esma, this is where it really hits home. People aren't just choosing these implants for a nicer smile. They're choosing relief, stability, and the freedom to live without constant self-monitoring. I remember someone telling me they used to rehearse their smile before social events just to avoid embarrassment. When a medical choice starts influencing daily confidence like that, it's no longer a minor issue.
Exactly, Rasim. And we see this transformation often. Patients who once avoided conversations or laughed with their hands covering their mouth suddenly feel engaged again. It matters because it reshapes how they interact with the world. The right implant doesn't just restore a tooth, it restores emotional ease. That's why people call it life-changing.
Dr. Esma, I keep seeing this number everywhere. More than 80% of patients who switch to modern implant systems report feeling significantly more secure within the first month. That's huge, and it lines up with what we hear in consultations. Someone recently told me they had avoided speaking up in meetings for years, when after getting implants, their confidence shot up almost instantly. It's amazing how fast the shift can happen.
It really is, Rasim. And the most powerful stories come from people who struggled for a long time before finding the right solution. One of my recent patients had tried multiple temporary fixes with no success. When we placed their implant, they returned a few weeks later saying, "I finally feel normal again." Moments like that remind us why these technologies matter. They restore more than teeth, they restore identity.
Dr. Esma, here's what fascinates people, the science. Everyone hears advanced implant technology, but most don't actually know what makes it advanced. So let me ask you directly, what's happening behind the scenes that gives these implants their reputation for strength and long-term stability? Because the mechanics sound almost futuristic.
They do, Rasim, and that's because the material science truly evolved. Modern implants use surface engineering that encourages natural bone integration, almost like the body is welcoming the implant instead of resisting it. Think of it as creating a stable foundation where bone cells actually lock in. And when this process works well, it translates into everyday reliability for patients. That's why the science matters. It shapes the comfort people feel later.
Alright, Dr. Esma, let's break this down step by step because people love clarity. If someone walks into your clinic today saying, "I want a stable, long-term solution," what actually happens first? I think viewers imagine a complicated maze, but I know your process is surprisingly straightforward. Walk us through the journey.
Gladly, Rasim. Step 1 is a detailed consultation where we check bone structure and overall oral health. Step 2 is digital planning. We map the implant position with precision software, ensuring accuracy. Step 3 is the placement itself, which is often far simpler than people expect. And then step 4 is integration and follow-up, making sure everything heals perfectly. Each step is designed to be predictable and comfortable. That's how we turn uncertainty into confidence.
Now, Dr. Esma, this is the part everyone secretly waits for, the do's and don'ts. Because even with game-changing implants, one wrong assumption can cause headaches later. I've heard people say things like, "Oh, once the implant is in, I never have to think about it again," which sounds great, but also a bit too magical. What should viewers absolutely know before deciding?
Great question, Rasim. First, do follow your dentist's post-care guidance. Healing is predictable when instructions are respected. Second, don't ignore early warning signs like persistent discomfort. Third, do maintain routine checkups. Implants thrive in healthy environments. And finally, don't assume all implant systems are the same. Quality, planning, and technique vary widely. Making informed choices prevents future trouble, and smart patients take these steps seriously.